I'm Dr. Kenneth Levine. Welcome back to Health Talk. I'm here tonight with one of my favorite special people. Dr. Abby Wilentz is a pediatric dentist, a pedodontist, who practices in Plantation, Florida. Something unique, there's several things unique about Abby. She practices with her father, Dr. Dennis Trupkin, who's been in our community for about 40 years. And she joined him, and they have a father-daughter practice, and they're in Plantation, Florida. Abby, welcome. I'm so happy you're here.
Thank you so much, and thanks for inviting me.
Oh, it's great to have you. I know well, you're not a big person, you're a little person, but I know you since you were a little girl. Our families have been friends, and it's a joy to have you here. I know you grew up with Dr. Trupkin as your father, but when did you know you wanted to be a dentist? When did you know you wanted to be a pedodontist, a children's dentist?
Well, my childhood was very happy, and I always remember my father loved getting up, going to work. He loved coming home, and you can always see his enthusiasm about what he does. And I don't think really from a very young time in my life, it was always an interest to me. I always remember going to his office besides him taking care of my teeth, but spending Saturdays with him, and sometimes if they needed help answering the phones, I would answer their phones. And there was just always so much energy in the office, and it was just such a wonderful place that I saw, that I've ever seen. And I knew I wanted to be, in the dental medical field. When I was in college, I took like a first responder class, and I knew that was something I felt like I did not want to pursue.
Was it Emory?
At Emory, yes. Right. And I knew being a female was very important to me. I wanted a very well-rounded life. I knew I wanted to be married. I wanted to have kids. So I knew I took that in perspective. So it was kind of a very natural progression for me. I know when my father, since he was always so happy with what he did, and he is still very successful with what he does. My older sister, when he was kind of pushing the dental pathway, she went on to medicine. So for me, he really didn't say anything. So when I told him, Dad, I think I'm going to apply to dental school and follow your path, and he couldn't have been more happier.
I'm sure he was thrilled. I have to tell everybody that you take care of 5 of my 7 grandchildren.
And they're wonderful patients.
You take care of Michael, Lee, and Sophie from Florida, and Anna and Morgan travel from New York just to see Dr. Abby. I think that as a female, as a mom, it's got to give you a little advantage, a lot more insight into treating children.
Absolutely, because not only when you see a child very young, I try and guide them personally, what I've done with my own children. So I think you feel more comfortable discussing issues, meaning, feeding, either nursing or a bottle, or as they get into the teenage years. So I think for being a female in the dental profession, I think we have a huge advantage, not only professionally, but also, again, you could be an all-around person. You could be a mother, you could be, a dentist, and it gives you all aspects of life.
I've spoken with a lot of female dentists. I've spoken with, I told you, with a husband and wife team, and I asked the same question about males and females, and the husband said that he finds that women are instinctively more artistic, I know you're more gentle.
Right. And also most likely more nurturing.
As a mom, and as a young mom, beautiful mom with 3 beautiful kids, as I know you have, you know what kids go through. You know how scared children are, how frightened they can be, how insecure they can be.
Mm-hmm. Absolutely, and when you see a patient, not only do you see, guide them through their dental needs, but sometimes there's also a lot of other needs you have to deal with, either emotional needs, social needs. If they have an appointment and they're not really themselves, if you know that patient, you could tell that probably something's up or they didn't have a good day in school. So besides the dental aspect, the teeth aspect, you kind of get to know the total patient.
How much of what you have to do is dealing with the parents? Because a lot of kids come with baggage that they learn from their parents, I would assume. And
to be honest with you, Kenny, the hardest thing is the parents. Treating the child is easy. Right. And I know you probably see it yourself, but your generation and my generation, parenting is completely different.
Sure.
Parents like to be very involved. I know because I still work with my father, he's still trying to get used to it, but it was like the parents stayed in the waiting area and the kids came back.
We're going to come back in a moment. We're going to continue this very interesting discussion with Dr. Abby Wilentz. Again, I'm Dr. Kenny Levine at Health Talk, and I'll be back with you in just a moment. Thank you.
When you're smiling, the whole world smiles with you.